Hi, my name is Bill Kleinpeter. I have two questions, actually the same, concerning health care. First of all, a comment about the right to life, pro-life stand. If you could reiterate that, and what are your plans if you're going to continue with that, and how the battle's going to continue with that. Also, the elderly, the older citizens, as they age and as their health declines, what are their rights going to be, and how are we going to make sure that they're taken care of? Thank you.
Yeah. You know, I'm pro-life. Okay, let me start off there. So if you're not... So we went into committee. My committee was one of those that heard this. We started at 3 in the afternoon, and we went all night long. We finished at 6 the next morning. And I kept on thinking, why in the heck are we staying here all night? Until the subject of abortion came up at 4 in the morning. And then I realized they didn't want to be on C-SPAN. Didn't want to be on C-SPAN at 4. I knew there had to be a reason. And when the amendment comes up on abortion, the Republican amendment to make sure that abortions weren't mandated, it got stricken, and they didn't want that on C-SPAN. Turns out C-SPAN doesn't broadcast all night long. I didn't know that either. So, that said, let's talk about it. Right now, there's going to be and this is where I think it's fair to criticize the president. The president keeps on saying federal dollars won't be used for abortion. That's a false issue. Well, the reason he says that is that this public option plan is going to it's going to be set up by the federal government. It's going to be regulated by the federal government, and the people who run it will be appointed by the federal government. But they're not calling it a government plan. And so all the money that it receives will be money received by this plan set up like we just described, but they're not calling that federal money. They're not calling that federal money. And so even if it pays for abortions, he's saying your federal dollar won't pay for it because he's calling that money non-federal money. Yeah. That seems a little bit of a doublespeak. The second thing about it is, that really concerns me, is that the second thing that concerns me is that there's going to be somebody up there who's going to have such power. He or she will be appointed by the federal government. They're going to be a dadgum czar. I'm starting to hate that word czar. Instead, I'm going to start using the word commissar, okay? There's going to be a commissar that's going to decide what every insurance policy has to have. And so I'm in committee and I say, wait a second, this is 4 in the morning. And I say, wait a second, are you telling me that this person can mandate that every insurance plan in the United States covers abortion? And they said, that's possible. And I said, you mean the Archdiocese of Greater Baton Rouge would be required to cover abortions? And they said, well, we're not saying that, but it's possible. And I said, listen, how about if we just have I know where the votes lie. I said, how about just having an amendment where it doesn't prohibit an insurance plan from paying for abortion, but it doesn't mandate it? And the fellow said, abortion is one of those civil rights that you can only exercise if somebody is there to help pay for it. We reject your amendment because we think that society should help pay for the abortion. Well, I mean, that's when I knew that on some things there is no common ground, and there ain't on that issue. So I'll just say, on the right to life issue, there's doublespeak going down. Ask them, will you guarantee to us that you won't mandate that your insurance plan, if you're a small businesswoman, that your insurance plan that you purchase for your employees does not have to pay for abortion? They won't do it. And that's double talk. That's said. Secondly, the elderly. Well, American people aren't dumb. They know that if you're taking money out of Medicare, it's already going bankrupt, and sooner or later you've got to figure out how to save money. And one of the ways that they're going to try and do it is inevitably they've got to address the amount of service being provided. If you're doing it from a top-down approach, where in Washington, D.C., they're making decisions that influence how you interact with Jim Taylor back there, then it's a reasonable thing to be concerned that they're going to begin rationing care. Now, maybe they won't. Maybe they'll figure out how not to do it, but it's a reasonable thing to be concerned about. And frankly, they always kind of little wiffle-waffle on it, and so I think that's why we continue not to be reassured. And so I think it's a valid concern. I wish I could give you the answer, but it's not my answer to give.
Thanks for taking my question. My name is Ray Graves. I had a good greeting when I picked up my newspaper yesterday morning. In 2H block headlines, it was no cost of living increases for the next 2 years. Who's making the decision, and who knows what inflation is going to be next year, much less this coming year? What's your view on this?
Yeah, as regards Social Security, the question is, or the issue is that in Social Security, there's a Social Security Trust Fund. Now, Social Security is going bankrupt. Now, there seems to be a common theme here with federal and state programs. There is a common theme. They are not fiscally sound. So the Social Security trustees have said there's no inflation this year, so therefore there's no cost of living arrangement. But they also say there's not going to be inflation next year. And Ray, I think you got a good concern. How do they know that there's not going to be inflation next year? Oil just went up to $75 a barrel. And obviously fuel costs are one of the things that drive inflation in our country. And oil has continued to rise since its low when the crash. I agree with you. That just happened yesterday. When we go back to Washington, we'll visit that issue. But senior citizens have been told that they're going to get a cost of living raise. They've been paying into the system their entire life. By God, if there's inflation, they should get the cost of living raise. On the other hand, we go back to Bill Kleinpeter's question of is there going to be an incentive for the federal government to ration care for the elderly? When you got to save money, you figure out how to save money. And so I think that's why that's the reason why folks are concerned as to how they're going to ultimately treat folks who are on Medicare. And so I agree with your concerns. We'll know more about that when we get back to Washington.